Hi everyone. We'll let people come in and wait for a couple of minutes, and then we will kickstart the webinar. All right, so many are joining, so I think maybe we can start. Good morning, everyone. What is morning for most of you? As I saw on the registration that we have people coming from Europe and the US as well today. So welcome to all of you to our webinar, Strengthening Healthcare Ecosystems Through the Critical Role of Diagnostics, which is launching our new paper. So before we get started with the presentation, I just wanted to give you some background on APACMed and our Digital Health Committee. So Chris, if you can go to the next slide, please. All right, so really briefly, we are the only regional trade association that represents the medical device industry in Asia Pacific. We have different work streams called committees. So if you go to the next slide, please. Our Digital Health Committee is our most recent one. It was open in 2020, and as you can see on the slide, it now counts over 250 individual members from over 75 companies across the region. So we have a growing and engaged community in this committee. So our members range from startups and SMEs to large multinational companies. So basically, we work on all the product journey. We start from market approval, so our regulatory focus, to making sure that the product is affordable to the patient, so the funding and reimbursement focus, and finishing with the use of the product, so cybersecurity, interoperability, data flow, for instance. So this webinar that you're joining today is a co-initiative of the Digital Health Committee and our Government Affairs and Market Access, so GAMA committee. And yeah, that's it for me for the opening remarks. So I don't want to take too much time from our speakers. Just one last word. I think you're all familiar with it by now, but if you have any questions, feel free to use the chat function to ask all our panelists directly. Yeah, I leave the floor to you, Chris, to introduce the topic and present our speakers.
Great. Well, thanks a lot, Cindy, and hello to everyone out there. Hope you're doing well. And I think it's great that we have such a diverse audience of different stakeholders across the industry ecosystem, public and private sector. So please do feel free to use the chat as we go and not only put in your questions, but put in some comments and interact with each other as well. So my name is Chris Hardesty. I'm a strategic advisor to APACMed, and I'm the lead researcher of this report. And really the spirit today, I would say, is educational. This report was designed to be an educational conversation piece, and so that's how we've designed this webinar discussion today as well. And we have essentially three main parts to the agenda. So the first part is to relay to you some of the key findings from the report. And joining me in that discussion will be some of the industry companies who provided use cases for the report. And then the second parts will be to hear from the Lancet Commission. We have representation from Lancet commissioners globally and in the Asia Pacific region who wrote a landmark report about the value of diagnostics in 2021. So they've very kindly joined us and we'll be sharing some reflections from their work. And then thirdly, time permitting, we'll have some opportunities for interaction with the audience. So again, please feel free to put in your comments and questions, and we'll take some of those a little bit more toward the end. So with that, let me jump into it. Just to provide you a little bit of context for why we've undertaken this initiative as APACMed and in the Asia Pacific region. One of the reports that APACMed published during the pandemic was basically looking at the role of diagnostics in helping to manage COVID-19. And so I'll touch on that a couple of times during the session today, and we do mention it in our report. That's not the sole focus of our new report, but just to say that sort of kickstarted the discussion here, just because all of us felt the impact that diagnostic technologies were playing during the pandemic. But really in 2022, we came together because we felt that even with the realization about the role of diagnostics during the pandemic, there still is some issue around the value recognition that diagnostics receive within our broader health systems. And so as Cindy mentioned, this is a collaboration at APACMed between the digital health and government affairs and market access teams. And the way we performed the research was a deep secondary literature review, which is why, for example, we have the Lancet commissioners on the call today because they'll be sharing some of their peer research. But then also we did some primary research in the form of collecting use cases from APACMed industry member companies who will be sharing later today too. And we do cover not only infectious disease, such as what was observed during COVID-19, but also looking at the broader spectrum of diagnostic interventions for chronic disease as well. And in the report, we break down, kind of market archetyping in the region to look at maturity of adopting diagnostic solutions. And then finally, most importantly, the idea is really, again, educational to provide a platform for discussion during the pandemic, but also beyond. So this has been a multi-month effort, but very proud to say that as soon as this webinar finishes, the report will go live on the APACMed website. So here you can see a snapshot of the cover page. So as soon as this webinar is finished, you'll be able to go download that. That'll be publicly and freely available from the APACMed website. So what I'm going to do is provide a little bit of highlights from the report, and then again bring in some of the industry companies to share more from their perspective too. I think a couple of positions in the report that are key for the audience to understand, and firstly is that we see the interlock between diagnostics and the broader objectives of universal health coverage in the Asia Pacific region, and that ranges from earlier identification of disease patterns and even screening of healthy populations all the way through to more effective disease management. And so this is where you can see initiatives like the WHO's Essential Diagnostics listing, which gets published every year, and also the Lancet Commission report, because of that intertwine between diagnostics and broader health system. And in fact, some people call this the decade of diagnostics, with respect to all the objectives that we must meet by 2030. And also in the report, we look at going forward as well, the role that diagnostics can play in decentralized care models. So for example, we look at places like Australia, which 20% of their population is considered rural and indigenous, and that cohort of people actually has 4 times the disease burden of typical urbanized populations. And so they've taken a very proactive approach on using diagnostics to decentralize the care models. And we also look at the state of Odisha in India and how they managed the COVID-19 situation by working very much at the village level through their experience with other crisis management interventions through diagnostics. So again, we've covered this in the report, just in enabling new models of care. But I think most importantly, there is a bit of a disconnect here between the role that diagnostics plays in our health systems and the value that is assigned to it. And so here you can see the disconnect between the decision making that occurs as a result of diagnostics versus the healthcare expenditure that is assigned to it. And so one of the things we look at in the report is, just making sure health systems understand the broad array of value drivers that diagnostics offer. And so we look at place-based care, like I said, and kind of decentralized care models, helping to reduce medical errors throughout the system. And also, and one thing I'll touch on in just a minute, is even more advanced ways of capturing value, such as the role that diagnostics companies play in local employment and R&D investments as well. So all of that has to be considered. And in fact, there's an interesting study we cite in the report, which says that despite the perception that testing may be overutilized, actually studies show that they're underutilized by about 50% in the Asia Pacific region. So a lot of opportunity there to ramp up the effort. And one other key concept we talk about in the report, which is related, and how all the different stakeholders can kind of interconnect with each other and share better, is the role that diagnostics technologies play in information and the information age of healthcare. And so this is called Value of Diagnostics Information, VODI, and it's really about personalizing and making more precise the care journeys that all of our populations will be embarking on. I'm not going to go so much into detail on VODI in this discussion or in the report, but it will be the focus of some future APACMed efforts later on in 2022. So just to put a bit of a plug there. And I think if I could really just summarize, we've got a bit of a fork in the road, because on one hand, diagnostic technologies can allow us now to intervene much earlier and even screen healthy populations and just manage that situation in a more effective and efficient way. But unfortunately, in many cases, what we see is the opposite effect, which is delayed diagnoses and poor management of disease, which has even costlier effects for our societies. So we really hope to push more toward the former rather than continuing down the path of the latter. The other thing we do in the reports is we do break down the archetypes of kind of the geographies in the Asia Pacific region, because we realize that not everybody's in the same place in terms of the way that they might adopt diagnostic technologies and assign value to them accordingly. So one archetype we put forth is maybe those countries that are still in process of achieving their universal health coverage goals. And here, what we find is the diagnostic pathways tend to be quite fragmented. So we need to think a bit differently about what steps we can take to achieve this value vision for diagnostics. And, one thing the Lancet Commission report points out is there's a diagnostic gap, which is basically the percentage of all patients that are out there versus those who ultimately are screened and tested and diagnosed for certain conditions. And that gap is greater than 60%, which is quite high. And in fact, in the Asia Pacific region, what you find in archetype number 1 is that only about 19% of those populations even have access to any form of testing, and that's an avoidable annual death of about 1.1 million lives. So it really racks up. And one thing we do in the report is give the example of India, which has over 100,000 labs, but only about 1,000 of them are accredited systems, and the resourcing model is about 1/8 what you would find in other places like New Zealand or the US. So again, just thinking a bit differently about how we can bridge this gap. And in the report in India, we, through our friends at Nat Health, who published a similar report on diagnostics, we look at the role of technology and how we can just make that process a bit more seamless for our populations. The good thing for archetype number 1 is there's a lot happening with respect to public-private partnerships. So one thing we talk about in the report is the World Economic Forum's effort to drive diagnostics value for archetype number 1. And they calculate that the cost to benefit return ratio would be 24-1. So the opportunity for impact is quite high if we're able to do something about it here in this archetype. The second archetype we put forth in the report is what we call archetype 2, which are those countries that have essentially already achieved universal health coverage in most of the sense. And so, again, they're thinking about diagnostic technologies and value might be slightly different. And one thing that's interesting that we found about this archetype is in some ways the issues they face with diagnostic technologies are a characteristic of their own kind of design flaws, which have need to evolve basically. And so examples here include that in some of these archetype 2 countries, being able to purchase antibiotics is actually cheaper than even being able to purchase the diagnostic test, which is just incentivizing the wrong behaviors. Or similarly, what we find in archetype 2 countries is the need to rebound more quickly on things like elective procedures to get their health systems back on track. So just a different set of issues and challenges to face. Here we look at countries and geographies, for example, like Taiwan, which is really stepping up in the biobanking space, but then also, calling attention to places like Japan, which have essentially been cutting the prices on diagnostics rather than investing in them vis-a-vis the value that's provided. We also point to Singapore, which took the Lancet Commission report that we'll talk about momentarily and actually hosted a forum in February this year to openly discuss the value of diagnostics and the future of diagnostics. And so we encourage this type of gathering and recognition as well. And I think ultimately the key point here is for archetype 2 countries, there are more advanced ways to calculate the value that the diagnostics industry is delivering to our health systems. And that can include in the form of the investments in R&D that happen locally and employment, and even things like artificial intelligence and the Global Alliance for Genomics, which is now available to countries. So here, those are some of the recommendations that we provide for the archetype 2 countries. And again, it's a bit of a blurry line, and not to say all countries or geographies are one or the other, but just to provide a little bit more tailored discussion related to where a particular geography might be on its diagnostics journey and what are the near-term steps that they can take to start assigning more value to the diagnostics that are delivered. But anyway, open for discussion, and of course, happy to hear your thoughts as well. With that, what I'd like to do is call in some of the industry companies that contributed to the report as well. So the industry companies are going to share a little bit about their reflections on the topic, as well as the use cases that they've provided for the report. And then we'll talk about some of the recommendations in the report and then hear from the Lancet commissioners as well. So with that, let me first call on Anne. She's the Asia Pacific Director of Market Access and Public Health Policy. And Anne, if you could maybe talk to us a little bit about the views from Abbott and the Abbott use cases.
Thank you very much, Chris. And I think that you have outlined very well on the critical role of diagnostic, but unfortunately it has been undervalued and therefore unfunded. And what we have seen with especially the pandemic that has really shed a limelight to the critical role of these diagnostics is also that healthcare systems should be evolving to, and many of the countries nowadays are looking at how can they transform their healthcare system to become more resilient, either to prepare for the next pandemic or to manage the rising burden of the aging population, the rise of non-communicable disease and chronic diseases. When we think about how we can better transform the healthcare system, it's also about looking at very much how you have pointed out, where the focus has been very much on treatment and acute care instead of looking at the prevention, screening and surveillance, and detecting early on the high-risk patients. So this report really highlights these key components to think about how we can better look at an integrated system, both with centralized and decentralized community care settings. And these are some of the examples in this report, looking at that power of decentralization and connecting with the centralized healthcare settings. So the first one is obviously on everyone's mind is how the COVID-19 rapid test has transformed the way and really contributed significantly to the management of the pandemic. And the example that we have shared from Abbott is how Abbott has early on engaged with the Indian government to have that open dialogue, combining the rapid test solution with so the PanBio COVID-19 test with the Navika solution to help the Indian government with real-time disease surveillance capabilities that can enable them to have immediate testing results and interpretation with the built-in artificial intelligence features. So the second case that we have presented in this report is really around that connectivity and coordination that we have seen in the first case with the AIG's point of care solution in New Zealand that really combines that a platform of data sharing between hospitals and clinics, community-based settings that really helps to drive the data rapid diagnostic landscape for better public health management. And the last one that I would like to highlight in this report is really how to prepare again for the future and for the rising burden of cardiovascular diseases, which affects 1 in every 5 people with a survival rate lower than certain types of cancer. And by a broader screening, the studies have shown that we can reduce the risk of cardiovascular disease by 10% and showing a gain of life expectancy of 27 years. And so Abbott with its high sensitive troponin-1 blood test would help to better and more accurately predict this cardiovascular disease risk and improve that triage for those who need most help and to be directed early in the healthcare system. So I hope that these 3 cases from Abbott will really show how important it is to have a strong collaboration between private and public sectors, and also collaboration between centralized setting as well as decentralized community-based healthcare settings, so that we can really provide a more timely, accurate access for help to the of patients to care.
Super. Thank you, Anne. Appreciate that. Okay, next let me call on Varun Vegas, who's the Asia Pacific Policy and Strategic Partnerships Leader at Roche Diagnostics, to share more about their perspectives and their use case. Varun, over to you.
Great, thank you, Chris, and thank you, Anne, for those fantastic opening and use cases. So I would just like to reiterate, 70% of clinical decisions are based on diagnostic systems. But like Anne said, the value of these diagnostics is still pretty much undervalued globally, and especially so in the Asia Pacific region. So the use case that Roche contributed here is for liver disease, right? And it really exemplifies the value of diagnostics in the entire continuum of liver disease, all the way from viral hepatitis and when it evolves into something very serious like hepatocellular carcinoma. So there is an infographic in this report that we have put together, especially for this use case, that really walks you through the entire liver disease continuum and the value that the diagnostics bring to this whole journey, starting from screening for viral hepatitis, the possibilities of diagnosis, looking at treatment decisions, so ensuring the best treatment is selected for the patients, the possibility of monitoring across the hepatitis disease, as well as when it progresses to HCC or liver cancer, hepatocellular carcinoma. There is possibility to deploy diagnostics for surveillance as well as monitoring and diagnostics as well. So it really exemplifies, how there is a possibility to use diagnostic solutions across liver journeys with this use case. Now, beyond that, Asia Pacific is also home to a significant disease burden from liver perspective. We have here in the low middle income countries a significant disease burden in hepatitis, as well as hepatocellular carcinoma. And especially if we appreciate this context a little bit, the whole spectrum really talks about the whole journey being underfunded, patients not having appropriate access. And then beyond that, if we zoom into just one part of the spectrum, which is HCC, most of the HCC cases are detected in later stages, which means there is very little chance of curative therapy, and the mortality is high and the survival rates are also low. Now, there are also studies, that really talk about, with effective use of diagnostics technologies, the mortality can dip all the way to 37%, and even the survival rates can increase all the way to 50%. So there is a lot of work to be done in expanding access to diagnostics, especially around the liver care continuum. And I hope with this report, we start to at least have the right conversations. And now with that, I'll hand it back to Chris, and I'm very interested in learning from Norden as well as the Lancet commissioners.
Super. Thanks, Varun. And yes, last but not least here from the industry companies, we have Nordine Sharafi, who's the Asia Pacific Market Access Director at Illumina. So Nordine, over to you for your comments.
Thank you for inviting me to participate to this program, Chris. Thank you for inviting me to this webinar to introduce Illumina's perspective. So as you said, my name is Nordine Sharafi. I'm the Market Access Lead for the Asia Pacific region at Illumina. And for those who are not familiar with my company, Illumina is a global leader in genomic testing. We are dedicated to improving human health by unlocking the power of the genome. And our technology is responsible for generating more than 90% of the world sequencing data. So because of this position, Illumina is committed to enable the access of our technology to those in need and remove the barriers to access. This pledge is very much at the core of our market access team's objective, and that's why we decided to join this effort led by APACMed, because we saw an opportunity to synergize with other stakeholders active in the diagnostic space with the hope that it will incite the necessary reforms in the region. So for this program, we selected the non-invasive prenatal testing, and IPT in short, as a case study for this program. And it's a test used during pregnancy to inform on the risk of chromosomal anomalies for the fetus. And we selected it as a use case, because it actually represents the situation of genomics in the region. Indeed, despite staggering evidence on the clinical benefit of NIPT, despite the ability of this test to allow the decentralization of care to ensure equity of access, and despite an expansion of coverage and reimbursement in developed global markets over the past few years, there is none of the countries of the APAC region that are reimbursing NIPT. So through this effort, we are calling the decision makers to hear the voice of expected parents and the clinical community to put in place the necessary framework to recognize the value of genomics in the region. And we hope that the recommendation that are put forward in the report will be acknowledged and implemented in the region, which we think will give us the platform to promote the value of genomics to the healthcare system. So thank you very much for hearing me out, and over to you, Chris.
Great. Well, thanks, Nordine, and to Varun and Anne as well. In addition to the use cases that you've heard discussed here, we also have examples in the report from areas like tuberculosis and multiple myeloma from other member companies. So just a great array of different types of care pathways and interventions. And I hope that people who read the report find that useful to bring some of the concepts to life. And so last but not least, from my side, as Nordine kind of alluded to, there were recommendations from the report, and then I'll call in the Lancet Commission team to share some of their views as well. So there are recommendations provided in the report by market archetype as well, but these are kind of the main 6 just macro kind of recommendations that the report concludes around. And again, this is more of an educational, conversational piece. So these are just some ideas to get discussion started between public and private sector. But, first of all, is just leverage some of the momentum around COVID-19 that, the topic of diagnostics is quite high. So there's an opportunity to pause here and reflect a bit on the role that they play and how to capture some of that value. And one of the things that we provide in the reports is a really nice table from a literature review that was done in South America, but it's global in nature, and it provides many different value frameworks for diagnostic technologies. So that's just a nice basis for countries to get started with. And then secondly, and relatedly, we would just recommend that all nations in the region reflect against the WHO essential diagnostics list, as well as the Lancet Commission frameworks that are provided, because these are great ways to see where kind of countries are on their journey. And again, I highlight Singapore for having hosted the forum in February, and we'll hear from Prof. Tan a little bit later about concepts like that, but just starting the dialogue, right, and trying to see where we are respected to some of these frameworks that have been put forth. And then thirdly, we just do continue to emphasize there's no need, we believe, for markets in the region to just create new standards or kind of new technology review processes. The more we can harmonize the reviews of the technologies and the data standards and rely on other leading nations for the regulatory approval process, the faster, we believe everything can move and give patients greater access to the testing that they need. Fourthly, would be just, once some of those steps are done, really making sure that resourcing is right-sized for diagnostic solutions. Again, I showed earlier that there's a big disconnect between the resourcing that is applied to diagnostic technologies and the role that diagnostic technologies are playing in our health systems. And so this needs to be corrected. This is where probably the market archetyping process can come into use. You can kind of archetype your particular country and see which steps fit the best and try to resource appropriately. Here, we would also recommend taking a look at talent and workforce within the ecosystem and making sure public and private sector are prepared for the next wave of embracing diagnostics. And then finally, number 5 is probably a bit more orientated toward market archetype number 1, which is really just about getting into the conversation around value diagnostics and making sure that this legacy of kind of under prioritizing screening and diagnostics is something we can start to overcome. So that's a little bit of joining the conversation. And then probably for archetype 2 markets is number 6 here, which is just having a little bit more transparency and collaboration between public and private sector about the ideas on the diagnostic strategy for the country, as well as the, let's say, reimbursement coverage schemes that are coming into place, such that we can capture more advanced forms of value that I talked about earlier in the presentation and that we cover in the report as well. So these are the 6 main kind of recommendations that are provided. And again, it's meant to just be a little bit of fuel there for discussion across public and private sector, but also at a localized level in each country in the region. So I realize that's pretty rapid fire, but again, the report will be made available as soon as this webinar is finished. You can download and read more detail. I'm looking forward to hearing from you. Next, what I'll do is call on our Lancet Commission colleagues to share some of their views, but I would remind the audience out there, it's a great time to start thinking about the questions you want to ask, and you can put those in the chat or the Q&A box, and we'll take some of those after we hear from the Lancet Commission team. Okay, well, with that, here we go. I did want to call out a great report that was put out by folks we have on the phone here today, as well as a whole team from the Lancet Commission, and I put the link down there in the chat. We use this Lancet Commission report as a basis for our APACMed report, so I'd highly recommend everyone to go check it out. Many of the themes are directly related. There are different views as well coming from different stakeholders, but for the most part, it formed the basis of our thinking as well, which is why it's wonderful they can join us today and talk a bit about their research and the work that they all do respectively in their own markets as well. So with that, I'm just going to call on each kind of commissioner here to share a little bit, and then we'll open it up to the audience as well. So first we have Dr. Michael Wilson joining us late from the US. He's a pathologist at Denver Health. He's also a professor and vice chair at the University of Colorado Department of Pathology. And as I mentioned, he's a global representative of the Lancet Commission for this study. So Dr. Wilson, over to you for your kind of comments about your prior research and just what you think of the discussion so far.
Thank you, Chris, for that kind introduction, and thanks to everyone who joined this webinar today. The Lancet Commission on Diagnostics was part of an evolutionary process. I first met Dr. Fleming, the chair of the commission, 10 years ago at an international meeting. And we began working with a number of individuals in global health and global diagnostics over the next few years. And our first crystallization of our thoughts about how to address the issue came out in a chapter in the disease control priorities volumes that came out a few years ago. And at that time, we met up with Dr. Sue Horton, who's a health economist from the University of Waterloo, because in the disease control priorities books, you have to have an economist to look at the economic aspects of global health, financing, costing, and so forth. And we then began working on another set of projects, which was culminated in a series of publications in the Lancet a few years ago. And these were about pathology and laboratory medicine in low and middle income countries. There were 3 papers in that series, and they highlighted many of the pieces of background information that eventually made their way into our commission report. That's also when we started working with Professor Louis a few years ago. And after the publication of the series, we met with the editors of the Lancet, and we said the next logical step would be a Lancet Commission, which is a more formal piece of work with a lot of original research, more comprehensive literature review, and so forth. But when we met in New York City 4 years ago, we said, we've done a lot of work on pathology and laboratory medicine, but there's a key piece of diagnostics that we've not dealt with yet, and that's diagnostic imaging, radiology. So we made a very conscious and deliberate decision to broaden the scope of the work we have been doing for a few years and invited a number of other commissioners in the field of diagnostic imaging to join us. So the commission was formed a few years ago and really began work 3 years ago. We had 25 commissioners from 16 countries, and we had representatives from again, from pathology, laboratory medicine, diagnostic imaging, public health. We had surgeons, we had internists, 2 former ministers of health, a very diverse group, who then spent the next almost 3 years working on the commission. And we published that, as Chris has alluded to, last October. And the commission report is long. It's over 50 pages long. It has a lot of technical information, but there were some really key findings that came out of this, as well as some key recommendations. And Chris has already alluded to a few of these, but in some modeling studies that Professor Horton and others did, what we learned was the shocking fact that 47% of the global population has little or no access to diagnostics. When you move into low and middle income countries, that drops down to about 19%. And even though we all recognize on this webinar how diagnostics are central, fundamental to quality healthcare, it's really not recognized in a lot of other areas in global health, which results in underfunding and inadequate resources. And it's particularly interesting that when we looked at what's called the last mile problem, which is for the poor, rural, and marginalized communities globally, the people who have to walk more than 2 hours to a hospital or clinic really have no measurable access to diagnostics. As others have noted on this webinar, the COVID-19 pandemic really emphasized the critical role of diagnostics in healthcare. But it's also not just in pandemics, in global health security, but also dealing with universal health coverage, the issues of antimicrobial resistance and other areas, cancer screening, cancer control. So we've highlighted a number of these in the report. We did note that innovations that have developed in the last few years, particularly in technology, changes in workforce, they can be used to reduce the diagnostic gap and improve access, but there's a long way to go to realize that potential. One of the other modeling studies we did, we looked at 6 priority conditions, and these were in one of the slides that Chris showed earlier. If one looks at diabetes, hypertension, HIV infection, TB, and hepatitis B and syphilis in pregnant women, that if we could just take the current level of access to the level of 90%, we could avert 1.1 million premature deaths annually. And then again, as Chris has mentioned earlier, the economic case for investing in diagnostics is strong. The median benefit to cost ratio is high, and the range is from 1.4 to 1 to 24 to 1. So the return on the investment in diagnostics is real and it's tangible. But again, we don't believe that a lot of people in the policy arena are aware of this yet. So those are just some of the key messages from the commission. Again, would encourage you to read it. And at this point, I'll turn it over to my colleagues. Thank you.
Yeah, well, thanks, Dr. Wilson, and sorry to have stolen your thunder on some of those statistics, but I guess that's why we closely married up these 2 reports, right, to synchronize with each other. So again, thanks for sharing your views and for joining quite late there in the US. And yes, let us continue with the Lancet Commission perspectives here. So Professor Tan Bien Su, who's a senior consultant at the Department of Vascular and Interventional Radiology at Singapore General Hospital. He's also an adjunct professor at Duke in US and the U Llewellyn School of Medicine. And of course, he's part of this Lancet Commission team that published this prior report. So Professor Tan, we'd love to hear your thoughts as well too, please.
Thank you very much, Chris. I'd like to congratulate APACMed for launching this report on the critical role of diagnostics, and that we acknowledge that much of it has been based on the report put up by the Lancet Commission of Diagnostics. I personally was very glad to be invited to join the commission, because in my own very little way throughout my career, I've recognized how diagnostics and imaging, from which the field that I'm in, is often overlooked in funding of programs. Oftentimes, programs will be funded from the treatment point of view, but not enough thought all resources put in to support the diagnostic pathway to achieve diagnosis before treatment can be effected. So, you know, the theme of the commission resonated very much with me. I've also traveled around the region and observed how neglected diagnostics have been in many of the countries around the region. So I would, like Mike, encourage all of you to read the report in detail, specifically the 10 recommendations that have been put up. Now, Chris alluded to an event that we organized in February, hosted in Singapore, but many commission members, including Professor Louis, played a very important role in that event. And we decided to focus on 3 of the recommendations of the Lancet Commission report. First, diagnostics workforce expansion and upskilling, governance and regulatory frameworks for diagnostics quality and safety, and the development and appropriate use of technology. I'd like to comment on 2 of these from my personal perspective. Number one, this being an APACMed event, I see a lot of opportunity for APACMed members to work together with the healthcare professionals to provide good quality education for the healthcare workforce in diagnostics. Just want to reiterate that there's very strong local and regional expertise in the Asia Pacific countries that can help APACMed members in educating the appropriate use of diagnostics. You know, what I've observed often in the past is that industry spends quite a big sum of money to fly very renowned faculty halfway around the world at significant cost. I think nowadays there is a lot of expertise in the Asia Pacific region, and we can help in education at a much affordable cost. Of course, with the virtual platforms, this can be again supplemented with participation from world experts. The second observation I have is that oftentimes I find industry, when they introduce new technology, to some degree try and oversell the highest end technology. I think there should be responsible recommendations from industry partners to end users on the appropriate fit for purpose diagnostic equipment, so that we can achieve long-term value of the work that we do. These are the 2 things that I would like to bring up for further discussion. Thank you.
Super. Thanks a lot, Prof. Tan. And I think it's good to see a lot of the recommendations are interlocked again between the 2 reports and fair provocations, you know, and I think that there are aligned interests here and hopefully just opportunities for more discussion. And I know there's a lot of industry companies listening in today as well. So some fair points and some platform for discussion, certainly. Okay, and then last but not least, from the Lancet Commission representation is Professor Loy Lai Ming, who you've heard referenced a couple of times already. So she is a senior consultant histopathologist at the University of Malaya. She's also on the executive committee of the Malaysia Academy of Sciences and the founder of the Malaysia College of Pathologists, among many other credentials. But yes, Professor Loy, over to you for your comments, please. Thank you.
Thank you, Chris, and thank you for inviting me to this launch. Well, I'm a practicing anatomic pathologist, a diagnostic pathologist. So my focus all my working life has been like any other medical doctor, how to use knowledge, skill, and harness technology for the benefit of my patients. And being an academic at a university involved in training of medical students, as well as medical specialists, adds another dimension to my interests and commitments, that of embedding a practice culture that is evidence-based and a judgment culture that is value-based, always in favor of the patient. Now, this sounds very wonderful and great, but it's an understatement actually, because in view of the dichotomous pull and demands in all directions in our practice, especially in a country like Malaysia, where there's a lot of resource limitation, it is not something easy to achieve. So working on the Lancet Commission on Diagnostics was very important for me. It was a major project where we could honestly dissect out literally all issues that diagnostics face together and the root causes of the problems. And unlike many projects that I worked in, it did not stop at just pointing out what was wrong, but to seek to provide roadmaps to solutions while mindful of local regional variations and needs. As you know, the Lancet Commission on Diagnostics makes 10 recommendations, and time does not permit me to articulate all 10 of them, but many of them jive very well, if not all of them actually, with today's forum. I'll just quickly mention 5, which I think are of particular relevance. At the national level, firstly, creating a national diagnostic strategy. Secondly, making tests for key conditions available at all primary care centers, the last mile problem that Mike referred to. Commit to regulatory framework and to support quality. To improve affordability of diagnostics and develop and use technology in ways that benefit everyone. What I like most about the APACMed report that was launched today is the match with almost all the views of the Lancet Commission. But mostly, I like the highlight on the value proposition of diagnostics in healthcare. This is a concept that still needs to sink in with both policymakers and diagnosticians alike. And also it needs to sink in with patients and the wider society, who are more easily impressed and therefore exploited by many newfangled tests that may come into the market. It is, to my mind, not all right to just pump in more and more tests, but one needs to ensure that there is rational use of them and beneficial outcome from them. In simple words, misutilization and overutilization of tests can be as harmful as unavailability of tests, although we do recognize that currently there are a lot of places where tests are still not available and are unutilized. Now, my working day as a diagnostic pathologist involves assessment of various molecular biomarkers, companion tests, genomic mutations, which directly target therapy for patients, especially cancer patients. But I can also see that besides the benefits it gives to patients, we can also easily exploit the situation. One can easily make money by doing a lot more tests than necessary, by including those that have no value or dubious value, because perhaps they're just good to know or they're just fashionable to have. And I know that many rich patients will just happily pay out of pocket for them. So I welcome the notion of a private-public partnership in the development and delivery of new generation of tests guided by the value proposition, so that a beneficial outcome to patients and society is the ultimate objective. And this would jive with the Lancet Commission recommendation to develop and use technology in ways that benefit everyone. And I certainly look forward to further engagements in this space. Thank you very much.
Thank you, Prof. Loy. I'm glad that was the last contribution there, because I think it tied everything together very, very nicely in terms of the platform for discussion on some of these issues. So thanks for framing that well. Okay, well, to the audience out there, now you've heard from all the speakers and we've got a little bit of time, not too much. And I've seen a few questions come in, so I'm just going to try and take those and then we'll wrap up. And obviously today is just the start, right? We'll have many more future discussions. Maybe Varun, if I could, there's just a quick one here. You can just kind of knock it out a little bit. There was a question because you presented the liver use case. So there was just a question around, is this one of the main focuses in disease area for Roche in the Asia Pacific region? So I don't know if you want to comment on that quickly.
Right, so Chris, it's one of the focus areas. Roche has a plethora of diagnostic solutions, all the way from infectious diseases, cardiovascular disease, oncology, liver, lung, breast cancer. We have a big focus in women's health as well. So cervical fertility. So it's the whole spectrum.
Super, thanks. And obviously people can follow up with you after if they want more information. And there's a question in here that I think I'm going to first pose to Prof. Loy and Prof. Tan, and then I might come back to Dr. Wilson for his kind of views on it, and then we'll try and kind of wrap things up. And if you guys can, just kind of keep your comments a bit tight since we don't have too much time left. But I think, obviously we're saying a lot in this discussion today about the direction of travel that needs to happen for the value of diagnostics. But, maybe you can just speak a little bit of your own thoughts. Here's the question of just, really where are we at in the Asia Pacific region with the perception of diagnostics and therefore adoption rate? And obviously COVID-19 is one thing, but maybe a bit more broadly. So I don't know, Prof. Loy, Prof. Tan, if you guys want to comment on this one, and then Dr. Wilson would love to have your comments on the same, maybe a bit more globally as well.
Perhaps I could start. I think we know COVID has really focused the lens on diagnostics in a way that it has never before. I mean, the tests controlled everything. It was on everybody's mind. Tests determined who gets locked down, who goes into quarantine. Tests determine whether businesses can open, who can travel, and everything. So everybody is focused on tests, but actually there are a lot of issues behind tests which the public, wider society, as well as policymakers, politicians do not quite appreciate. And one of the areas I think is with regards to the deployment, development of tests, and regards to quality. I think quality is an issue that we do need to address and perhaps get the public as well as policymakers to understand better. There are a lot of chains, a lot of processes behind developing tests that are reliable and that actually delivers what they set out to do. So I think there's a message that needs to be actually highlighted. There are tests and there are tests, and there are kits and there are kits. Actually, it's very important to understand that to really deliver value, you need to ensure the quality behind the tests. Of course, all that has to be balanced with the affordability issue and availability issue. And it ties up so much with also training and education behind it, that there's such a huge ecosystem behind the development and deployment of tests. I know I'm answering a very broad sense, but I'm sure my colleagues will have comments to make in further detail.
Sure, yeah, it's a bit of an open-ended question, but and probably we'll have to keep the comments a bit tight here, guys, so we can have time to wrap up too. But yeah, Prof. Tan, anything else you wanted to add to Prof. Loy's comments there?
Yeah, thanks, Chris. I echo what Prof. Loy has said, but I think on the whole in the Asia Pacific region, I think we still lag very far behind in terms of appropriate investment in the diagnostics field. And I reiterate the point that it's still quite neglected, and I think APACMed members really have a good role to play in partnership with healthcare providers in coming out with a strategy for appropriate and affordable diagnostics.
Super, thanks. And Dr. Wilson, yeah, I mean, I don't expect you necessarily to answer about the Asia Pacific region per se, but yeah, any reflections from you on this question?
Yes, thanks, Chris. In our recommendations at the end of the report, we had a number of things that needed to get done, but I think in recognizing But the essential problem with the lack of access to diagnostics is a lack of visibility among policymakers and funders. So one of the first things we're working on now is trying to get a World Health Assembly resolution on diagnostics. We're actively working on that right now. And the second thing is this concept of forming a global alliance. And there have been a lot of ideas put out on that over the years, but I think we're starting to see some movement in that direction towards something that's tangible. But that's just a highlight of two things that we're working on. But again, I honestly believe that until we raise the visibility of diagnostics in a lot of different areas, that solving this problem is just not going to happen.
Yeah, thanks. And I think it's something we reiterate in our paper too, about just getting involved in the conversation, right? There's platforms to do it, so people need to get more involved. And maybe on a related, question as we start to wrap up here. So I'll come to Nordine and then back to Anne, and we'll wrap up with Cindy. But Nordine, there was kind of a related question here about next generation sequencing. So maybe if you, again, just kind of quickly, but where are we at in the Asia Pacific with adoption of next generation sequencing in your opinion?
It's nascent and it's growing. And to maybe respond to the question that was asked about the cost, we hope that with the growing utilization of NGS, that will bring the cost down. If we look at the past decade, the cost of NGS has dramatically reduced, and I think cost will definitely go down as adoption increases in the region. But I think, to bring it back to the topic of the discussion, I think it's more about and putting in place the frameworks that recognize or assess appropriately the value of NGS that are missing in the region. And we hope that by putting in place that sort of framework, it will allow more recognition of NGS, putting in place the appropriate funding, and hopefully increasing the utilization in the region.
Super, thanks. And again, it's great to have different forms of expertise here, so I think people can follow up, with you if they want to have more questions. So with that, I want to be respectful of everybody's time. There's lots of questions in the chat just about where we go from here. So I think that's a natural transition. We have put some next steps here, and I'll hand it over to Cindy. I would just like to say thanks to everybody for joining today, to the speakers, but also all the authors of the paper, some who are here, but many others as well. So just wanted to say thanks to the Lancet Commission too. And really today is just the start, right? I mean, lots more discussion that we need to have, but maybe, we've got some things listed here, and I think Cindy could talk through those and kind of close up the webinar, but maybe Anne, I think, we haven't heard again from you since the first. So is just from your mind, where do you want to see things go from here, and then you can hand it to Cindy to wrap up.
Thanks, Chris, and really appreciate all the comments and suggestions from the esteemed panelists, and the very, very active engagement from the participants. As what we would like is really, as I said, engage in that conversation more and more with help from all the APACMed members and attendees of this webinar, so that we can really reach out to the key decision makers on how to integrate better diagnostics in the healthcare system, in the delivery frameworks, as well as in terms of payment and funding mechanisms, so that we can really increase that adoption of diagnostic in an appropriate and fit for purpose way.
Super. Well, with that, I know we're about out of time. So Cindy, I hand it to you to kind of talk about next steps and wrap things up. But again, thanks to everyone and the Lancet Commission team for joining as well.
Thank you, Chris. And thank you to all our speakers for the presentation on this really important topic. So as mentioned, although many efforts are made to promote diagnostics technologies and tools, there is still a lot of work to be done to unlock access to this solution in an appropriate way. So I believe that all of you that are attending the webinar today understand the importance of accessing these diagnostic tools. So to put in place all these recommendations highlighted by Chris and by our speakers from the Lancet Commission and from our 3 manufacturers here, we really need your help. So The report will be published onto the APACMed website, and tomorrow you will also receive a link to our recording and a link to the paper itself. So we really encourage you to share this internally with your team and with your network as well. As always, when we create new work or new knowledge at APACMed, we then activate it. So we will share the paper and the recommendation with the key opinion leaders, with policymakers, and engage them through public-private dialogues, putting emphasis on the country archetypes that were presented earlier. As it is rightly indicated on the slide, please promote the report among your network and reach out to us with suggestions on how to take the conversation forwards. If you can move to the next slide, Chris, please. And yeah, really briefly on a different note, just finishing this webinar by mentioning that we have 3 symposiums coming in the next 2 months. So you can register by scanning the QR code on the right. The 3 symposiums are regulatory transformation on the 26th this month, the future of patients on the 9th, and value-based market access on the 27th. So if you can move to the last slides. Yes, that's it for me. So thank you all again for joining. Again, the slides and the recording of the session will be made available to all of you on our website, and we will send you an email. So feel free to reply this email with any questions you will have. We'll also answer some of the questions that I see on the chat, and we will answer by email. And we hope to hear from you soon on the project activation. So have a great rest of the day, everyone, and thank you for joining.